Hello, my name is Veronica Chigoziri Obodozie. I am speaking from the traditional lands of the Anishinaabe, Haudenosaunee, and Mississaugas in Toronto, Canada. I will be presenting in the space technology session with respect to society on behalf of the International Space University. My topic is mitigating impacts of pandemics through infrastructure and logistics support. The global economy was hit due to strict governmental measures to contain the pandemic. These measures included border closures, social distancing measures, curfews, and closures of physical non-essential services, amongst other things, of course. This work is an extension of the Interactive Space Program, ISP20. I would like to take some time to acknowledge our warriors of this pandemic, especially those we lost. That reflection time probably brought a lot of pandemic effects to mind. That is similar to the methodology used at the Interactive Space Program, 2020, where 29 people from different disciplines and parts of the world came together to find out how space technology can be used to mitigate the effects of the pandemic. Through brainstorming the different ways the pandemic has affected our countries and sectioning them into distinct sectors, mitigation steps were outlined. All this complemented by expert speakers from a range of different backgrounds to help research recommendations on how space technology can be applied to some of the outlined steps. From the ISP20 recommendations, satellite-enabled broadband, satellite navigation, and GIS application, as well as unmanned aerial vehicles, are the technology implementations that will be highlighted. In this paper, an overview of regional impacts will be highlighted as well, and space-enabled solutions outlined together with existing recommendations. Some of the issues at the time of the ISP20 report included reduction in traffic due to border closures. Because of this, tourism was affected due to air travel reduction. There was lots of loss of jobs and decrease in logistics efficiency due to extended operational cycles, which was caused by land movement restrictions. Exports and imports issues exacerbating an import-dependent region. Current impacts, not much change, but inequality is more visible, with digital solutions inaccessible to certain groups depending on geography and/or economic vulnerability. Infection and death rates vary between areas in the region, with the increase in death rates in the Caribbean islands as of May 2021. Vaccination rates are on average not too good as well due to slow rollout and supply. However, booking systems in places like Trinidad and Tobago can be improved. Overall, these are some, not a lot, obviously, of the impacts on the Latin American and Caribbean region. This is where space comes in. One way space can help is by improving connectivity with satellite constellations, communications infrastructure, enabling broadband connectivity, ensures access for all It also helps small and micro-sized businesses coordinate logistics with a cheaper entrance into the digital market. It enables digital learning, reducing the internet distribution inequality. Telemedicine and health provision especially benefit from this. This reduces the hospital burden, cross-infection risk, while reducing patients' anxiety about outbreak and overall overcrowding. Remote diagnosis and treatment via satellite-enabled telemedicine reduces the risk of spread while addressing the inequality issues of solution delivery. Satellite navigation and GIS systems are another way. Adapting routes to avoid contagion areas, monitoring patients, and transport are just some of the few that will be highlighted. GNSS-based vehicles, real-time updates of infected patients using GIS-driven data, people and case tracking, which at this point in time, contact tracing is being enabled through GPS-enabled tracking apps. Although some privacy issues come up when monitoring and tracking movements of people, overall, mapping of the infection rates also help public administrations inform policy, the policy that exists. Logistics and supplies can also benefit from this. A major advantage of satellite navigation is the ease of logistics maintenance. While monitoring containers and other shipments, this in turn protects workers from infection as well as contagion. As many of the contagion regions can be avoided, implementing other integrated methods like drones for supply. Speaking of drones, unmanned aerial vehicles can help with the delivery of a range of products. It is especially good for medical supplies with companies like Zipline in Rwanda, Ghana, Nigeria in existence. It can be used to deliver test kits, vaccines, and more. Seeing as I've shared some of the already existing technology and how they can be applied, here are some of the few interesting spin-offs that would be very useful in situations like this. Both are from the Canadian Space Agency, and they're being tested by astronauts on the ISS, International Space Station, with a great potential for Earth applications as well. The biosuit monitors and records vital signs and sends that data directly for analysis. It's useful in communities with limited access to medical support. The bioanalyzer frees up storage space as a few drops of fluid are needed, and it quickly gives the analysis as well to the body fluids. These are just some of a lot, I guess, of the space technology that exists or are being tested right now that would be very useful. Space technology, including spin-offs and integrated approaches, can be used to solve a number of pandemic impacts on society. This includes satellite communication, which can also be used for global connectivity and provide quality internet and access to remote regions, ensuring remote learning, work, and healthcare delivery. Efficient distribution and reallocation of emergency goods to areas of short supply can be achieved using Earth observation data and geographical information systems, GIS, while UAVs, unmanned aerial vehicles, assisted by position information, can help with delivery without the need for human contact. Delivery of food and medical supplies, which are both essential. Thank you so much for making time to allow me to be a part of your learning journey. If you would like to contact me, feel free to connect with me on LinkedIn and check out my blog, or message me via email. I would also like to thank my institution and all my fellow crew members. These are some of the references. These are the long list of wonderful people that worked on this project with me. Thank you once again. Have a lovely day. Goodbye.